Hello, my name's David Cass. I'm the president of CISOs Connect. This is a CISOs Connect podcast. I'm joined today by Erik Decker. So Erik, thank you so much for joining me. And if you could kind of introduce yourself, your current title as a CISO, and we'll carry on from there.
Yeah, thanks, David. Erik Decker, I'm the CISO for Intermountain Health. We're an integrated delivery network that's located in the Mountain West region. So we have about 7 states, headquartered in Salt Lake City. An integrated delivery network means that we have both the patient care side as well as the plan side. So we have a plan with 1 million lives and 34 hospitals, hundreds of clinics, 7 states, 70,000 employees, 16 billion in revenue. So we're a pretty big shop in pretty much the Rocky Mountains, right in that area.
Yeah, I mean, it's definitely a sizable organization. And you've been in the healthcare space for a very long time, and you guys have probably some of the most sensitive data that any organization can have. So, even pre-COVID, how have you seen, I guess, the healthcare system change, and especially, I guess, pre and post-COVID as well? How have you had to adapt to those things as a CISO?
Yeah, I think the biggest changes that have happened have largely been driven actually by our adversary. So when you think about what the adversary is doing, 10 years ago, stealing data was primary, and I think the cost per record, you hear this going from somewhere between $100 to $200 to $300, $400 a record. Those are some metrics that are used. That for sure has increased over the last decade. But I think what significantly changed was when the organized crime figured out how to cause disruption. As the healthcare system adopted all this technology, largely through the meaningful use program that was stimulated through Obamacare, to getting hospital systems and clinics off of paper and onto electronic medical records and getting into interoperability, that exploded the digital environment by which healthcare operates in a positive way. That's what we want to happen. But then that became an interesting attack surface for organized crime. And then when you start tying in the care that we take for patients with uptime, now you have a business disruption ripe opportunity, so, and we're caring for people's lives. So the stakes are high, so if our systems aren't up, then we potentially have harm kinds of cases that can happen. So that definitely changed. The first, known ransomware case where a hospital got shut down was Hollywood Presbyterian. I think it was 2016 or 17. And that was like the first wake up call to, there's a new game in town, and the game is resilience and business disruption.
And I guess, since I guess attackers don't really have any boundaries anymore, and, ransomware is kind of I guess it goes for any opportune target. How have you had to, think about hardening the organization? Because as we know, ransomware is, a big entry through just social engineering too. So how have you had to kind of harden your environment as far as what you can speak to, as well as, how do you raise awareness when you have so many different types of clinicians?
Yeah. So, I think at the end of the day, it's actually a game of hygiene, where how we're getting beat is failure to have proper hygiene. And this is based on some national studies that have been done. The Health Sector Council Cybersecurity Working Group, in partnership with HHS and CISO, we actually did a study in 2023 where we looked at the state of how the hospital system is resilient to these kinds of attacks and what's wrong. This influenced the development of the cybersecurity performance goals that were released for healthcare just this year, which is depending on how the administrations sort of take this, turn into minimum standards. How is it happening? It's really dumb, unfortunately. The sophistication of the actor is the scale that they operate and the information and the analytics that they have. But they're running the same playbook every time across the board. So it's 3 ways they break in. One is social engineering, the phishing and so forth. But there's also new attacks. I guess not really new anymore. Attacks where they just call the service desk and they already have the last 4 digits of your SOS, your date of birth, your email address, your home address. They have all of that because it's been compromised 10 times over. So if you're identity proofing based on last 4 digits of SSN, they'll just impersonate that person and they'll enroll a new device, a new MFA device, and then you've gotten past MFA, full bypass. MFA fatigue attacks, like all of those are kinds of things that are happening. The second way is you have a connection with a third party, and that connection is risky. So maybe a permanent circuit, or a VPN, maybe they're running their own remote access tool to get into your environment, uncontrolled by you, and they get whacked and they pop over. And the third way is a known exploded vulnerability that's on the internet. So that's a specific defined term, known exploded vulnerability, that CISA produces a list of vulnerabilities that they track that are being exploited by bad actors. That's sort of like landing on the beach, but the same goal is that across the board for ransomware in particular is ultimately go after IT. The same people that control all the systems, they want to get access to the workstations and the credentials that those people have. And so they're attacking IT. They're attacking Active Directory. They're getting privileges through those systems. And once you have that, then you can deploy ransomware everywhere. Then you can steal the data and do double exfiltration. Then you can do all kinds of other things that you would want to do. So in my opinion, my focus, has been, we have to cut that playbook off at the knees. We have to make that, think like the adversary. How do they do what they do? Stop them in the front and stop them on the last thing. And if we can do that, then we're going to cause them to slow down significantly. They will not be able to scale at the same rate that they're scaling, and it'll cost them more money to continue doing more attacks. We're never going to stop them from doing attacks, but the game is we want to slow them down.
Yeah. So in addition to the attacks, I'd say on the main systems, more and more medical devices are connected and becoming part of that whole IoT network of things. So do you have to think about these devices differently now before they come into the facilities?
Yeah. MedTech is, so I liken this to the urgent versus important. MedTech spaces is important. Right now, they're not being leveraged as the attack vector in. They could be a jumping point, in that line between first and last thing that's being done. But that does not mean that this is not a critical problem. It is a critical problem. You just have to understand sort of the velocity of the problem. The one way that MedTech actually is a fairly urgent issue is there's a lot of these medical device manufacturing companies that manage their technology through their own remote access systems. And so you end up having all of these remotes way in, which is the second way I described that you can get broken into, that is uncontrolled by you. And so we have to do a better job as an industry of controlling that. And then, on the flip side of that, I mean, I think everybody's probably seen the Homeland series, the second series, spoilers, Vice President gets killed because he's got a pacemaker and they, cause a shock, they hack the pacemaker. Haven't seen that happen yet. Haven't seen, that kind of attack like materialize. Not to suggest that it can't happen. I think where you likely see those kinds of scenarios are very high profile cases where it's highly targeted by a specific individual, or as the actors are going to switch their methodologies as they can't just do large-scale disruptions, they'll go towards fear of, we've compromised your medical technology and we're going to cause harm unless you pay us, like that kind of extortion attack. I can totally see that in the cards, or they're already working it, and it's scary, but how we control all of that is like the classic way you control all your OT systems. You segment it, you try to maintain patch cycles as appropriate. Got to work with the manufacturers when you do that, get better telemetry through, some real-time systems that can monitor that stuff, and, keep the blast radius contained.
Yeah, I mean, those are all great points. And then, as you think about it, since healthcare is, part of a critical kind of infrastructure, I know you've been very active in this space. So could you talk a little bit about, the work that you've done? Yeah,
so I'm the outgoing chair of the Cybersecurity Working Group with the Health Sector Security Council. This is a critical public-private partnership with the federal government. We're one of 16 critical infrastructure that have been defined under the National Defense and Authorization Act. And so finance has one, oil and gas, water, energy, and so forth. And, within this group, we've produced 27 best practices over the last 4 years. 3 of them have been joint co-branded with Health and Human Services, and one of them has been embedded in law, which amended high-tech of HIPAA and high-tech. And effectively, these practices are about how can we get to better hygiene? How can we get to better, talked a lot about the medical device, situation there. We probably have, I think, somewhere 6 to 8 different publications on that alone. We built an industry-specific product on pre-negotiated contract language that the hospitals and the MDMs work together on that we all agree to. So like that's a way of like raising the bar across the board, which is super useful. We did this landscape analysis where we studied sort of what the resiliency of hospitals are, and that informed HHS's strategy for cybersecurity, which included minimum mandates that are coming shortly, voluntary practices, a stimulus to help the needs-based organizations who don't have the funding to do this. The group is actually quite robust. There's 450 organizations that are in it, over 1,000 members. But we have more than 450 organizations that make up the national healthcare system. So there should be 10 times that, frankly, in this group to coordinate on it. The previous national cybersecurity director, Chris Inglis, the first one in the White House, he came to us and charged us with an awesome goal, which I love, and I really try to think about this a lot, which is that we have to set this system up, this whole cooperative defense system up in such a way that the bad actors should have to beat all of us to beat one of us. And that sort of vision is a solid sort of concept. It's a rally cry that says we're actually all in this together. We're not competing against one another. The adversary is the actual adversary. So we have to do better, across the board to do that. It's very hard, of course. Lots of barriers to making that happen, but I think it's the right rally cry.
And those are all great points. So as we get ready to wrap up, I guess what, for newer CISOs, since we talk about like the A100 and things like that, where we have some of the up and comers, what like 2 or 3 points would you recommend to any, new CISO, new in the security space?
Yeah. So first, don't fall into the trap that just because you got the executive title that you think you can issue edicts and orders and everybody will just like lock and fall right in line and do exactly as you say. That's not how the job works. I think a lot of early executives think that, if only I had the authority, this would all be better. It's a job of influence. That's at the end of the day, you are there to get the trust of your executive team and your organization. You get there to get the trust of the board. You're there to continue to communicate with them in their language about what's happening. So you're a translator. You're an influencer, a relationship builder, and you have to have the technology chops to at least to understand. You're not doing the work. You shouldn't be doing the work. If you're doing the work, you're doing something wrong. But you need to have the chops to know what is the potential. Where is technology going? Where are all of these vulnerabilities fit together? And ultimately building those strategies and plans to mitigating this in a reasonable way. Risk-based, threat-centric kind of mindset. So that's what I would suggest. Be patient, listen a lot, and build relationships. That's going to be really important.
Yeah, those are all excellent points. So Erik, thank you so much for joining me today.
You bet. Thank you.